Most of the time when you're having a baby, your body knows exactly what to do, and your labor is going to progress just as it should. But sometimes labor can stall out or get too slow, and we need to do some things to help you have a safe delivery for you and the baby. We want to go over some of those things so that if they should happen to you, you have a little heads up before it starts to unfold. This is a fetal heart rate monitor. There are two different types of monitors. These are radio, and so they don't have any cords on them, and so that you can walk around more easily or go in the water with them if you want to get in the bathtub. And then there are other ones that are attached to a cord. Sometimes we use internal monitors, and those look like this. They have a small tube that goes inside right next to your baby's head, and this actually can measure exactly the strength of a contraction. So it helps us to know if for some reason your labor is not progressing, how strong is the contraction? Is that the problem, that we just need to give a little more oomph to the contraction? So that's what we use that for. And sometimes we're concerned about your baby's heart rate, and we really want to be able to measure every single heartbeat. And this is an internal monitor that we can attach just under the skin on your baby's head so that we can more precisely measure the baby's heart rate. So this is what a fetal monitor is like. Sometimes you'll be on it all the time, and sometimes you don't need to be on it very much at all, and we just need to check in to make sure that your baby is doing well. So this is the corded monitor that just plugs in right here, and then this goes onto your belly to be able to hear the baby's heart rate. So we'd use the corded one if you were resting in bed or maybe on the labor ball next to the machine, or maybe the radio one needed to charge. One of the things that we might do is we might need to give you medicine to what we call augment your labor or make your labor stronger. So for example, if you're marching along in labor and you get to 6 or 7 centimeters and you just stop changing your cervix for a number of hours, we might notice that your body is starting to get tired and your uterus isn't working quite as well anymore. So we can give you some medicine called Pitocin that goes in an IV in your arm. Pitocin is the human-made form of the same hormone in your body that makes your uterus have contractions. And all we do is give you a very low level, drop by drop, to just give that extra little boost to what your body's already doing so that you can keep progressing in labor. You might also hear about Pitocin because we use it to induce a labor, if we need to induce labor as well. But in this case, I'm talking about using it to augment or make your labor stronger or more productive. Other things that we might do are things to help your baby. Sometimes in labor, your baby's heart rate can show us signs of stress. Now we listen to your baby a lot on the monitor, and you don't need to worry about every little change that happens in the baby's heartbeat because we expect those. But sometimes we start to get concerned about the pattern of the heart rate, and we'll do things to try and help your baby. Some of those things might be changing your position, and sometimes changing your position a lot from this side to that side, or maybe on your hands and knees or standing up. Or other things that we might do are give you more fluids through your IV. A lot of times when you have an IV running in labor, it's just plain liquid. There's no medicine in it, but we use it to keep you hydrated. Remember, when you're in labor, it's a little bit like running a marathon, so you need to keep yourself very well hydrated. So having an IV can sometimes help, especially if you're nauseous and having a hard time drinking. And then sometimes, even more rarely, we put fluid inside your uterus to kind of replace that little cushion of fluid around your baby. If the water's broken and there's no longer fluid around your baby and your baby's showing signs of stress, if you can imagine it, it's kind of like reinflating the water balloon so there's not the pressure on the baby's cord anymore. So those are some interventions we might do to help your baby. Sometimes when you're pushing, we may decide that we need to help the baby be born more quickly, and we think we can do that by helping the baby from below with a vacuum. That's like a little suction cup that's placed on the baby's head and just gives a little bit of extra oomph while you're pushing. If we would need to do that, we would consult with the OB doctors who are on the floor to help us, or Dr. Leonard Smith, our family medicine doctor, may do that as well. But usually we do that in consultation with the doctors. The last thing that people sometimes like to ask about or have concerns about is an episiotomy. Now, some people may not have heard of that, but an episiotomy is a tiny little cut down on the perineum that sort of opens your vaginal opening a little bit further and can make some extra space. Most of the time, this is not necessary. In days gone by, they used to do this all the time to every woman having a baby. But we don't do that anymore because it's just not needed. But sometimes, in very rare occasions, and to be specific, about 3 occasions last year with our service, we will make a little cut down there to try and help the baby be born more quickly. And that's usually if your baby's starting to show some signs of stress and we really want just those couple extra minutes so the baby comes faster. If we need to make a cut like an episiotomy, of course we'll put stitches down there as well. Oftentimes when you end up having stitches, it's not because anyone cut you down there, but simply the tissue tore a little bit as the baby came out, and that's not uncommon. If we do give you stitches, those stitches are going to dissolve all on their own. Nobody ever needs to take them out. After your baby is born, there's a few things that also could go wrong or need a little bit of extra help. After your baby is born, the placenta needs to come out. Sometimes the placenta either stays in and doesn't want to separate, and we call that a retained placenta, or part of it will come out, but some of it will still stay in. Sometimes we can help with that by using medicines, either a shot in your leg or some medicine in your IV to help your uterus contract and push that placenta out. Or sometimes we need to use a hand to go in and help and manually actually remove the placenta. And very rarely it has to be removed surgically. Of course, if any of those things were starting to happen with you, we would let you know and communicate with you what was happening. And if any of those things were happening all along the way, we would help you with some sort of pain medication or anesthesia to help you with anything that was uncomfortable.